Right, I'm gonna call our September 2024 Health and Human Relations Commission meeting to order. Welcome, everybody. Happy to have a quorum today. So our first order of business is to vote on the minutes from our last meeting, which DJ sent out. Was everybody able to look at those? So I will move to approve those minutes. I'll second. Okay. We actually need to vote. Forget. Okay. I'm getting all mixed up with town council meetings. Like we all need to say aye. I don't know. But they're approved. We all looked at them and Kami seconded it. Let me know if there's any disagreement there. All right, number 3 on our agenda is time for public input or agenda items that were submitted online. And I did not see any agenda items submitted online. I don't see any public other than our press. So I'm gonna move on past that one unless there's anything we have. Okay, great. So number 4 is to follow up on action items from the previous meeting. So our first one is follow up with for Dave to follow up with EMS about Narcan at events. So Dave, did you?
Yep, they have them on the ambulances, and then the what they call the other person in the car that's not in the ambulance, they have it as well. So both vehicles that go out have it on board.
One thing I found as I was out and about this month, there's lots of like nonprofits in our community that work with individuals who are working through addiction and things like that, and they are really interested in having Narcan on hand in their organizations and their offices. And they were like asking me if we've heard anything about where to find it or if there's options to get it for free in places.
Yes,
it's
okay. Yeah, I can get that information out to people. Yeah, it's very easy. There's an organization out of Indianapolis, and you go online to request it and they send it to you. And so that's how I've gotten doses to keep to. Sometimes I've seen people that might need a dose in downtown.
Sure.
There's an organization, Jeffersonville and Louisville also, and it's widely publicized on the radio.
Okay.
One of the things they do stress is if you have it, that you need to know how to give the Narcan, because a lot of people think you can just squirt it, and that doesn't do anything for them. They need to actually be flushed in.
Also, our health department, they do, when they have it on hand, you just have to watch like a 5-minute video on how to administer it, and you can get Narcan for free at the health department. I know when I was encouraging my personal medical provider, because I had heard of other places doing this, where if someone is prescribed an opiate, that they also be prescribed or required to have Narcan on hand in the event they need it or someone in their home wants to get a hold of it. And my provider at that time was right across the street from the health department. And so she started making her patients like go there, show that they have it. And
so I got cards from those people that I met with at those events, so I can follow up with them.
Okay, great.
I think like you said, the health department's got it.
Okay. And so if EMS has it, then EMS is typically at most events we have, especially the large events. So we know that it's there.
They are, but I don't know all of them. Like I'd be curious to know like Mad Hop Festival, it's an all day kind of walking. It's not just a congregated event like Regatta where they're posted up.
Yeah. I wonder
if the event organizers can maybe.
Yeah, and I wonder if there are either city or county like ordinances or rules that require a certain level of first aid or healthcare to be available at events depending on their size? Do you know of anything like that?
I think in the county, there has to be an event plan
Okay.
that talks about medical, resources available. So, I mean, they just had a side by side or maybe a motorcycle event over the weekend. They had, they got, I think, because a lot of things going on here that Switzerland County EMS was covering it, so they had some there. So I don't know their particulars, but they do have to have that plan, at least for county events. And I'm thinking, I heard that there's also one for the events in the city,
Okay.
but
Yeah, I wonder if there's a way to put like an additional like line in any of them to say that the provider needs to have Narcan available or something like
I mean,
that.
every EMS truck is going to have
They're gonna have
multiple
that.
doses on their truck.
Yeah,
Yeah.
so as long as it's EMS there.
Yeah.
I'm just wondering if it's not EMS there, if they have like a first aid tent.
Right.
If they're gonna have it,
Right.
cause.
But that's the thing, Indiana law allows you to have it, you don't have to have a prescription, and that's why these nonprofit organizations that order it online. There's no negative effects from using Narcan. Whenever I did Narcan training with people, I would always stress that, like, if you're scared to get, don't ever be afraid to get it, like, well, what if they didn't take an opiate? What if they took something else? It only goes to the opiate receptors in your brain. So if you didn't take one, it doesn't do anything. An EpiPen is more dangerous. You give someone a shot at epinephrine, they need to be monitored, they're hard for a little bit, but nothing with Narcan, so.
Do we feel like we've covered that one well enough? Okay. So our next bullet point was, I was going to have a presence at the Hispanic Cultural Festival and Healthy Community Initiatives, Community Health Fair, and Youth Tailgate, which I did.
Wow, awesome, thank you.
Yeah. There were some good times had. I saw Dave at the community health fair. At each one of the events, I met at least one person who either themselves or they had someone in mind specifically that would be good for the commission. So I did my best to try to get info, but some of them were loud. I couldn't hear everything. So really hope they follow up, but I do have some contact info that I plan on following up with. And yeah, there were lovely events. I ate very well at the Hispanic Cultural Festival and,
Empanadas.
oh my goodness. The Healthy Initiative Fair, had good presence there. I think they're trying to figure out how to get attendance better. Because I had a lot of great conversations with the other organizations there, which was really helpful because of what we are. But we didn't have a lot of attendance, which is something I think they're gonna work on. And the youth tailgate was great. They had a lot of people there. The one challenging thing about that, it was intended for children. And I was just there with paper and everybody else had games. I was like, I'm sorry. This is disappointing for you. I'm here to talk to your parents.
yeah,
Right.
you go play the game, send your parents over here.
Yeah.
But every once in a while, somebody would walk by and give me like a stress ball or frisbee, and then I would give those to the kids when they came by. So yes, it worked well. I did meet some great people. So it was worthwhile to do those things. And I handed out little flyers with QR codes with our website, and I've been passing them around. So if y'all go to events, if I can give you this whole stack. If you go to events and want to let people know about what we're doing, this is an easy way to find us. And on our website, of course, is our application for membership and for suggesting any topics of discussion. So let me see if I have notes about anything else I wanted to mention about those things. No, I think that's it for those events. So yeah, the next thing on our follow-up on action items, Dave Bramer, share info about fair housing ordinance of Jefferson County.
So it's on the county's website. If you go under commissioners, it'll say ordinances. There's one from, oh, it's been a few years ago, but we did make an amendment to it in 2020. So the amendment is there in 2020. I can put it together and send it to everyone, but you can get it off the, like I said, the county website and go under commissioners and under ordinances and just look for fair housing and it's there.
Okay. Great, so we can look that over. Our next one, Dave Bramer will invite OVO to the meeting, to a meeting, not the meeting, to discuss the fair housing ordinance, and we can figure that out as maybe after our next meeting, we'll review the ordinance and then,
Was gonna make contact with them and then send them a copy of the ordinance so they have something ahead of time. And then I can talk about what they do.
yeah, do y'all want time to look it over and talk about it at the next meeting and then
And then,
the next meeting in the future, we'll invite them?
Sure.
Does that sound good? So in October, we'll talk about it and then in November, if we feel like it would be good to bring them into that conversation, we can talk to them in November.
Okay.
All right. Was there any other action items that I didn't hit on that people remember from our last meeting?
No, one thing that I did realize was we also need to approve the minutes from 2 months ago, because we couldn't do it last month.
Right. So 2 months ago would be, let's see, August. Was it June?
because we didn't meet in July because we were trying to, we had a conflict.
So we'll go ahead and,
Okay.
we'll squeak that in.
So that would be kind
I'm going to make a movement to approve the minutes from the June meeting, which I have reviewed before, just not recently. I'll second that motion. I'll just go ahead, since this was a weird one. Does everyone agree? Say aye. Aye. Any opposed? Okay, no opposed. Great. Thank you, DJ. All right, so our next item on our agenda, any new business from commission members? I have a few things, but does anybody else have anything that they would like to talk about? Any events that you've gone to this month? Any questions come to mind from people you've chatted with? Are you ready for a storm? Are there shelters in the community if we lose power or anything like that? Like designated ones?
Hmm.
We don't really ever know where the power will be out.
Yeah, I'm just so used to growing up in South Carolina and these storms being like a regular thing.
Yeah.
It's like, oh, this church and that church. So yeah, but it's so much rarer up here, so, okay.
I think it was 50-mile-an-hour wind, I think is what they're talking in some rain, so I don't know, that'd be too.
Yeah,
There might be a power outage, but,
we've dealt with
or there might not be power outage, just.
Don't say that. Don't
I know.
words.
I really hope not, because I can note that tomorrow, the Madison Youth Unlimited, / Madison Community Grocery Project is having an event at the Recovery Cafe. We're doing like a cooking demonstration, with all like fresh vegetables that are locally grown. With their sober social event, and I hope the power doesn't go out because we can't cook if the power goes out. So cross your fingers.
I don't even know what time it's supposed to come.
Yeah, I was just listening on the radio on the way over, and they say in parts of Kentucky, they could start getting wind tonight.
Yeah.
But tomorrow is when they're starting to expect wind and rain in this area, so. So, yeah. Charge your devices. Hey, tomorrow. The other things that I had on my list, for new business, we are going to vote on a new member. I shared back a while ago, by email the application, but, I did want to note as well in that discussion that the names on our website list all 9 people who are not all on the commission anymore. And I wanted to just kind of seek feedback from everybody if we think that it's time to take off the names of people who haven't been here in months and months and months.
Yes, I think it'd be nice to take them off, but it'd also be nice to say former members,
Yes.
so that they're still on there and they're still recognized, so people can ask questions. And if they don't run into one of us and kind of, because I do get asked a lot, like, so what do you all really do? And I'm like, well, you know, pull it up on YouTube or pull it up and, you know, you can see it. It's easier to watch than to see.
Yeah.
And so I think it'd be good to at least say, the keep a running list of former members, or not so much former, past,
Past members.
Yeah.
Mhm.
past service, and I think it's something past service members, so that way, because across the, you know, they were here and now, you know, they've been here for, and if we want to, even for that long, they were on the committee.
Yeah.
And so-
Do we think that that would be like a link we would want to put in to like our resources or something like that? Or do we want it listed like underneath current members?
I would put it underneath,
Okay.
because a lot of people, most people do not like clicking, and then have to click in, and then have to click in, and have to look, you know, they want it there.
Yep. Any other feedback on that, or do people agree? Sounds good. That sounds good.
Sarah, take care of that for you.
Okay. All right. So, for our next order of business, have we all looked at the application for our applicant Lindsay, or Dr. Lindsay Falstick? I will note that, Dr. Falstick, in a sense, could be looked at as replacing Dr. Lee, because she took over that position, when Dr. Lee left for another position. So, bringing a lot of the same kind of resources, and kind of, backgrounds, but definitely a different person with different things to add as well. Okay. All right, so now we have to figure out how to vote on it. So I guess I make a movement. So, I make a movement to add Dr. Lindsay Falstick to the Jefferson County Health and Human Relations Commission.
Do I second?
Do we need to decide if she's a two-year?
I think I was gonna do that next, because I don't know.
I think we will make a recommendation, because the commissioners in the end will
Okay.
do the final, but you still recommend if you want.
So we move to recommend to the commissioners, Dr. Lindsay Falstick as a new member to the commission.
I think we probably got spots for 2 or
3.
1. I think there were either 2-year terms or 1-year terms. And so if you want her, is she okay with 2? You might as well.
Yeah, let's
Might as well
lock her in.
Hook her for both.
That wasn't one of the questions on the application.
Well, we can ask her before it goes. Commissioner meeting is not gonna be for, well, another week.
Mhm.
And if it doesn't make it, then it'll be 2 weeks. But
Yes, I can check in to see if she's opposed to a 2 or 1-year term. So yeah, we can check on that. All right, so yes, I move to recommend Dr. Lindsay Falstick to the commissioners as a new member of the Health and Human Relations Commission.
I second that.
All right, good seconds. Wonderful. So we have nominated all in favor.
Yeah.
Oh, sorry.
And then it'd probably be a good idea to vote.
We will vote. Okay, so all in favor? Aye. Any opposed? Now it's approved. Ah, So bad at coding.
Oh, you'll get used to it.
I just haven't done it very
I
often.
know. Okay.
All right, very good. Any other new business?
I have another potential member, so this is good. I was gonna send her, but this will do all that I need to, so. Out of all of the solar meetings, I've had someone come up and talk to me. Well, we had a presentation at the last meeting, commissioner meeting, to look at, providing, so, like, which one is it, Life Spring or is that not? Life Spring, yeah. So Life Spring's gonna do an evaluation, basically. If we had a residential treatment facility, what are some of the things that need to be in it? Where does it need to be located? And so it's starting to do some of that. And this particular person was at the meeting and she was very interested in that. And so I said, oh, you are? So I find out she is from, I think she's in the medical field. She has been if she's not now. So, well, since Dr. Murphy has left, then someone in the medical.
I met somebody in the health field as well. It was like a new kind of healthcare facility in Hanover, like a Purian or something like that. And they're connected to that organization.
The nursing home.
Mm-hmm.
Yeah.
Right, at the event in Hunter Hall. I talked to him as well.
That's where I met them.
I gave her my card, haven't heard back, but that's fine. So,
Follow up,
yeah,
very good.
but yeah, so she seemed pretty interested. So I will get in touch with me. Do you think the QR code would translate if I scanned it and sent it in an email, or do I need to?
You
Okay.
could, or you could just send the link
just
to
send
the
the link.
website
To the application that's on our.
because that's more,
Sure,
a more direct way to communicate it
Yeah.
through email.
okay, I'll do that.
Mhm.
But she's,
Yeah. I know, in our last meeting, you mentioned, an event in early October. That was the deputy. I forget where the event was.
Chelsea,
Chelsea.
Chelsea.
yeah, the October 5th.
The Saluda Festival.
Is that little hard? Yeah, so.
And I don't know if it's like a health focused event, or like marginalized community focused event, but it's always good to just connect.
Community,
Yeah.
like you can rent a booth and set up.
Fall Family Fun Day, October 5th.
Noon,
Festival starts at noon. You can run anytime after 10 a.m. for setup. There's a very large open area and plenty of room for tables and booths. Be sure to bring a table, chairs, and tent if needed. There will be food vendors and live music.
I know I can't make it that day. It's our homecoming. Yeah.
Over there.
I've got a big reunion that day. So, is it something we want to try to set up a table, or is it something we more want to have people float if they go?
Yeah, I'll leave it. I have commitments that day as well.
Over the event name one more time.
Saluda Fall Family Fun Day is what I wrote down. Let me see if I can Google it.
See, it's just, both emails I have just like reference it as a family fun day at
Right.
Saluda Park.
yeah,
Saluda Fall Harvest Festival?
Is that what you're calling it? Okay. And it's a community effort with Pinus, Jefferson County and Saluda Township trustee to strengthen and foster community within our county.
Chelsea Park. Really quick to see it starts at noon.
noon to 3.
Noon to 3.
Yeah, I don't think I'll be able to make it that day, but
Our responsibilities.
I think just floating will be fine. I'm gonna be there, but I have another capacity to be there too.
I think that makes sense too, since it's not a health focused event or cultural focused event. It's good for us to just go and float if we are able. I know that, I'm going to a meeting on Monday, this coming Monday. I forget what day that is. The 30th?
Yes,
Yeah, the 30th. So Tuesday's the 1st of October. The Jefferson County Health Initiative is having their yearly update meeting. This is the organization that has been working on planning for some YMCA type possible thing that we talked to early on in our existence. So I got an email from them. I'm planning on going. I didn't have anything happening, so so yeah, if anybody wants details and wants to attend as well, let me know. I can pass it on. Do you want to go?
sure.
All
I
right.
mean, I may have my other hat on, but yeah.
Jefferson. Let me find the email. Yeah, I'll just forward it to both of you. It's gonna be at Ivy Tech at 5 p.m. Okay,
What was the date of that?
September 30th. Find my notes again. All right. I don't know if there's any other events I noticed, coming up next month. That made sense for us to be at, and I might need a break anyway. I spent many hours behind the table. But I think for good reason it was helpful. So for our next order of business, if there's no other new business. We review the action items for the next meeting.
All right, so the things that I have down are kind of loosely added as formal business. I have Jane Stormer and maybe Dave Kramer or Tamika Library will attend the yearly update meeting of the Jefferson County Health Initiative at Ivy Tech at 5 p.m. on September 30th. And that was about it in terms of action items that I have. Oh, and then,
I'll reach out to Sarah to update the website with info and talk to Lindsay.
Some fair housing ordinance out to everybody.
Okay.
So, and I guess I'll also add into this section that they will make a referral to somebody to apply to the commission.
And Dave's gonna talk to the commissioners about approving.
Sure, I get her on the agenda next meeting.
And then just when is our next meeting?
October 24th. And then in November is the 22nd, which is a Friday. We are doing a little earlier in October, we decided the last meeting, because otherwise it would have been on Halloween, which we
Right.
thought would be. I just don't like driving on Halloween when all the kiddos are out, so,
So next month is the 22nd.
24th.
And then November is the 22nd.
Yes, and we moved that to a Friday, and we moved it to not Thanksgiving.
Yeah.
So, yes, that is what we decided last time.
Okay.
This is crazy, I actually have the writing down for the 24th.
That's lovely. Oh, I think Dave sent out meeting maker requests.
Maybe that's what
I found that really awful. Thank you for that.
Do we want to talk all about December and what December looks like as we inch closer and closer to it?
No, I'm good.
I agree.
I don't want to think about December either. All right, so those are the action steps, the future meeting dates, and our next agenda item is adjournment, so I move to adjourn.
Second.
Then we are adjourned.